Welcome to your weekly pulse of wellness. I am your host, Tobi Adetayo, a dedicated sport physiotherapist with a passion for helping you live pain-free, healthier, and a more vibrant life. Whether you are just bouncing back from an injury, looking up to level up on your fitness journey, this podcast is your one-stop shop for expert insight and practical tips. Each episode we will be bringing you science-backed strategies to helping you live pain-free, feel stronger, and thrive every day. From athletes to everyday warriors, aged and pediatric patients, I am here to guide you on your recovery journey. So grab a seat, let's talk. So in today's episode, we'll be talking about a condition which is common amongst us today: stroke. What is stroke? What are the symptoms? How can we manage it? How can we live with it? On today's episode, joining me is a physiotherapist, a young, vibrant physiotherapist. She will be explaining her experience managing stroke patients. Physio Abimbola, please can you introduce yourself to our audience?
Hello everyone, my name is Gbore Abimbola. I am a physiotherapist.
Thank you, Physio Abimbola. Thank you for your time. I really appreciate. So, without taking too much time, can you tell us what stroke is? When we say stroke is a brain attack, what do we mean?
Okay, thank you. So, stroke is a condition that occurs when there is sudden interruption in blood supply to a part of the brain. So, it can be due to either blood vessel occlusion, which we call ischemic stroke, or blood vessel rupture, which we call hemorrhagic stroke. And when this happens, there is insufficient oxygen and nutrients to that part of the brain, causing the brain cells to get damaged within minutes. And it affects movement, speech, and also body function. It is called brain attack because it is a life-threatening emergency which occurs as a result of disruption to the blood supply to that part of the brain, and it requires immediate intervention so that it prevents permanent damage to that part of the brain.
Thank you very much. So, when we have stroke, when someone has stroke, or there is, I mean, what are the signs and symptoms of stroke that is common amongst patients?
Okay, thank you. So the signs and symptoms that is common amongst stroke patients when this happens, there is severe unexplained headache. We have difficulty understanding speech. Some feel dizziness. Some there is loss of balance and coordination. Then the most frequent one that we have is weakness of one side of the body, the arm, the leg. Then we also have slurred speech and drooping face. That's facial drooping.
Oh, right. I must have seen that. So, when we see stroke, why is timely intervention very important?
Okay, thank you. So timely intervention is very important because time is brain. So when there's immediate intervention or getting to the hospital within the first hour of the stroke occurrence, it could help to restore blood supply back to that part of the brain and also save the brain before the brain cells get damaged.
Thank you.
Yeah.
So, what are the three everyday habits that usually cause these clogs? I mean, that leads to stroke.
Okay. So the three basic everyday habits that leads to stroke. One is living sedentary lifestyle. So we can say physical inactivity. Then another habit is excessive alcohol intake and smoking.
Okay, okay. So, sedentary lifestyle, excessive alcohol intake, and excessive smoking.
Then we also have diets, unhealthy diets. When you take food that is high in salt, you take food that is high in cholesterol, fat, it's very, very bad.
Okay,
Yeah.
so there's this saying that you are what you eat. So apparently, what we eat too can lead to several medical conditions like
Yes.
stroke as well.
Yes.
All right, Physio Abimbola, how does staying active help as a shield or prevent this brain damage?
Okay, thank you. So, staying physically active, first of all, it helps to control risk factors such as obesity, then high blood pressure and blood sugar. It helps to control that. So, another one is it strengthens the blood vessels, thereby making it less likely to block or rupture.
All right, all right. So generally, physical activity can even prevent a lot of medical condition, especially stroke.
Yes.
Nice. Can someone who looks perfectly on the outside, can they be prone to stroke?
Yes, they can. Looking physically fit does not determine whatever you have. Like some people look physically fit and they have some risk factors. Do you understand? They have high blood pressure, some have high blood sugar, then some even have some habits that can predispose them to stroke, such as smoking, excessive alcohol intake, or all those diets that are high in fat. And also, once you have all those risk factors, they don't show in your physical appearance, but it can predispose you to stroke.
So the best thing to do is to, what I would assume will be to go for physical checks and of course stay
Yes.
physically active in itself.
Yes.
That's great. After stroke, let's say someone has stroke now, how soon can they start rehabilitation?
Okay, thank you. So, an individual can start rehabilitation even as early as within the 24 hours of the stroke occurrence, as far as the patient is already medically stable. The patient can start physiotherapy.
Oh, that's great. So as soon as possible,
Yes.
soon as possible, time is of essence. So we often hear the brain can rewire itself in
Okay.
stroke patients. How do simple exercises help the brain to rewire itself?
Okay, thank you. So the brain can rewire itself through what we call neuroplasticity. So after stroke, repeated simple exercises and task practices helps the brain to form new neural connections and also strengthen the alternative pathway around the damaged part of the brain. So with repeated movement and also therapy, the brain learns new routes to retrain and also improve the movement of weak arms and legs. So that is how the brain rewires
So,
itself here.
so just like a child that is just learning movement, so we
Yes.
retrain it. That's great. So for fitness lovers,
Okay.
how do we safely bridge the gap between basic rehab and getting back to lifting?
Okay, thank you. So, for fitness lovers recovering from stroke and wanting to return to weightlifting, it is actually a gradual, supervised, and individualized progression. So, it should focus more on strength, balance, coordination, endurance training before progressing to resistant training. So, starting with lightweight lifting will help to rebuild that individual confidence safely, and also monitoring their BP and the likes will also help to prevent further complications. Yeah.
Right, that's true. Well done, thank you. So if we could start one simple habit today,
Okay.
what habit would you recommend to lower the risk of having stroke?
Okay, thank you. So it would be eating healthy.
Okay.
Yes, you have to, abstain from eating foods that are very high in salt, cholesterol, fat, and the likes. Then you have to also stay physically active, do exercise, avoid sedentary lifestyle, and yes,
So
that's it.
that's actually three in one. Your diet is very important. Your physical activity is important. That's actually three in one. So generally lifestyle modification, which
Yes,
includes dieting and physical activities.
yes.
That's great. So before we round up, just one
Okay,
more thing. What is the most important mindset now? Because I believe that before an action takes place, it already occurred in the mind,
okay,
right? So what is that important mindset skill that a person needs to stay motivated when they are going through rehab?
okay. Thank you. So the important mindset shift should be moving from focusing on how fast the recovery is happening to focusing on the progress of the recovery, no matter how small it is.
Yes.
So sometimes recovery might be slow, but the improvement matters a lot, and celebrating small wins will help to get the individual motivated and also remind them that recovery is a journey and not a race.
So you heard it. Recovery is a journey and not a race. So that will be the end of our session today. Recovery is a journey and not a race. So if you have a stroke and you're just recovering and things like that, don't be in a rush. It takes time, but yes, recovery is possible. Again, if you do not have it, please stay healthy, eat very well, eat healthy, exercise, and of course, reduce the amount of alcohol intake and smoking activities. Thank you very much for your time, Miss Abimbola. We really appreciate, and I'm sure my
You're
audience also
welcome.
appreciates your time today.
You're
And they
welcome.
must have learned one or two things in prevention, management, and rehabilitation of stroke.
Yeah.
I remain your humble host, Tobi Adetayo, a dedicated sport physiotherapist. See you next time. Thank you.